Botox. Onabotulinum toxin A. Important information. Indication. Botox is a prescription medicine that is injected into the bladder muscle and used to treat overactive bladder symptoms, such as a strong need to urinate with leaking or wetting accidents, urge urinary incontinence, a strong need to urinate right away, urgency, and urinating often, frequency, in adults 18 years and older when another type of medicine, anticholinergic, does not work well enough or cannot be taken. Important safety information. Botox may cause serious side effects that can be life-threatening. Call your doctor or get medical help right away if you have any of these problems anytime, hours to weeks after injection of Botox. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms, including loss of strength and all-over muscle weakness, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, dysphonia, trouble saying words clearly, dysarthria, loss of bladder control, trouble breathing, trouble swallowing. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Do not take Botox if you are allergic to any of the ingredients in Botox. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myablock, Rhimabotulinum toxin B, Dysport, Abobotulinum toxin A, or Zeman, Incobotulinum toxin A. Have a skin infection at the planned injection site. Do not take Botox for the treatment of urinary incontinence if you have a urinary tract infection, UTI, or cannot empty your bladder on your own and are not routinely catheterizing. Due to the risk of urinary retention, not being able to empty the bladder, only patients who are willing and able to initiate catheterization post-treatment, if required, should be considered for treatment. In clinical trials, 6.5% of patients, 36 out of 552, initiated clean intermittent catheterization for urinary retention following treatment with Botox 100 units as compared to 0.4% of patients, 2 out of 542 treated with placebo. The median duration of catheterization for these patients treated with Botox 100 units was 63 days, minimum 1 day to maximum 214 days as compared to a median duration 11 days, minimum 3 days to maximum 18 days for patients receiving placebo. Patients with diabetes mellitus treated with Botox were more likely to develop urinary retention than non-diabetics. The dose of Botox is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported. These reactions include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Tell your doctor or get medical help right away if you experience any such symptoms. Further injection of Botox should be discontinued. Tell your doctor about all your muscle or nerve conditions such as amyotrophic lateral sclerosis, ALS or Lou Gehrig's disease, myasthenia gravis or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects including severe dysphagia, difficulty swallowing, and respiratory compromise, difficulty breathing from typical doses of Botox. Human albumin and spread of viral diseases. Botox contains albumin, a protein component of human blood. The potential risk of spreading viral diseases, Creutzfeldt-Jacobs disease, CJD, via human serum albumin is extremely rare. No cases of viral diseases or CJD have ever been reported in association with human serum albumin. Tell your doctor about all your medical conditions, including if you have or have had bleeding problems, have plans to have surgery, had surgery on your face, weakness of forehead muscles, such as trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, have symptoms of a urinary tract infection UTI, and are being treated for urinary incontinence. Symptoms of a urinary tract infection may include pain or burning with urination, frequent urination, or fever. Have problems emptying your bladder on your own and are being treated for urinary incontinence. Are pregnant or plan to become pregnant. It is not known if Botox can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Botox passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Botox with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox in the past. Especially tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myablock, Dysport, or Zeman in the past. Be sure your doctor knows exactly which product you received. Have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take antiplatelets, aspirin-like products, or anticoagulants, blood thinners. Other side effects of Botox include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. In people being treated for urinary incontinence, other side effects include urinary tract infection, painful urination, and/or inability to empty your bladder on your own. If you have difficulty fully emptying your bladder after receiving Botox, you may need to use disposable self-catheters to empty your bladder up to a few times each day until your bladder is able to start emptying again. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see Botox full product information, including boxed warning and medication guide, at www.allergan.com.